Hello, welcome again to Elite for Faith Productions, where we're interviewing Josephine Rivera. Say hi.
Hello.
We would like to ask you some questions about being HIV positive.
Okay.
And we would like to also get your input on how you feel and some of the things you've been through. First of all, Miss Rivera, how old are you?
I'll be 42 the 30th of this month.
Oh, wow, so you got a recent birthday coming up.
Yes.
How long have you been HIV positive?
7 months.
7 months? Wow, so that's recent.
Yes.
When did you find out and how?
I found out in Hialeah Hospital.
Oh, okay.
I was admitted, yes.
Hialeah, Florida. It's Miami still.
Yes.
Just a subdivision within Miami. How did you contract it?
Through sex. I was working in the street as a prostitute. I was an IV drug user, smoked crack. But actually my baby daddy gave it to me.
Oh, baby daddy drug.
And I just found out my 2-year-old has it too. She was just tested positive.
Your baby? Oh, so you got it also and passed it on through your child. So where is your baby?
She's in Fort Lauderdale with my son.
With your son? How old is your son?
He's 22.
22, so he's raising your baby.
Yes.
Oh, okay.
Actually, 3 of my babies. I have a set of twins that'll be 5 and a 2-year-old.
Oh, okay, so only the baby has it.
Yes.
So
No more babies for me.
Oh, okay, so where's the baby daddy?
Baby daddy is now sitting in the Dade County Jail for attempted murder.
Okay, so, oh wow, I'm dealing with also where the felonious crime, where people who actually know they're HIV positive and give the virus on to someone else.
Yes.
So did you know that he had it?
No, when I got diagnosed, I called him because he was really the only one I had unprotected sex with. And he knowingly had it for the past 7 years and told me he knew he had it. So I go to a program called Empower You, and they inform me of my rights, and I filed charges against him.
Oh,
He's sitting in the Dade County Jail with no bond status.
So do you know that there were other women that he infected?
Several. Actually, while I was sitting in the program that I go to for HIV patients, I ran into another young lady of mine, a friend of mine who knew he had it. He gave it to her, and she knew me and told him, you better tell Josephine because I'm a crazy Puerto Rican girl. So, but I did the right thing. I filed charges. So now they're going to file additional charges because my daughter has it.
Oh, okay. Well, that is a sad case, but it's also real because we also talk about the felonious crime. I have talked to people in high schools about this being a very serious charge.
Yes.
Now, I have a question too.
Yes.
Is he black?
Yes.
He is?
Yes.
Oh, okay. How does your family feel about this?
Really, my son is the only family I have in my daughters. My son knows, and you know, he wants me off the street. The gentleman I live with now, he knows. The one I thought I couldn't tell, I was scared to tell him. I just recently told him 3 weeks ago. Is the most supportive one. Then a friend of mine who was with me, who was supposed to be supportive, and when he got mad at me, went and told people in the street that I had full-blown AIDS, which I do not have. I have HIV positive. There are a lot of people ignorant of the virus still.
So can you tell people what's the difference between HIV and AIDS?
Well, I'm learning myself every day, okay? Right now I know that my T cells are up to 362, my viral load's 175,000, which I know everything needs to be higher. But I also know that when you go below 200, it becomes full-blown AIDS. But with this new medication, I'm on this new medication now. It's the new cocktail. I can't pronounce the name of it. Maybe she can. But I take 1 pill a day. It's 4 different medications in one. Makes you very sick. So really, if you're in the street, prostituting, doing drugs, you really need to stop. They don't consider HIV the black bomb anymore because they consider it like diabetes now. There is treatment. People don't die of the virus, they die of a piece of medication.
Well, you can die, well, you don't die from AIDS.
No.
You die from the symptoms that are caused by AIDS, like leukemia, like pneumonia. You die not from the virus.
Right.
I mean, you can live with the virus for years and years and years, and you can also go with the virus unknowingly until you actually go there to the hospital for some type of complication, and they test you and they find out. That's why it's very important to get tested.
Exactly.
Because you never know, and to have unprotected sex.
No.
Because many people think that it could never happen to them, and they could be rich.
I was one of them that said, you know, I know a lot of people now that I go to this program, and I've met a lot of lawyers, doctors, prestigious people who have it, and people don't know. I I'm a free spirit. I kind of, now I'm not ashamed. I tell everybody, even in jail, I had just recently got out of jail, and I let everybody know that it's just me. Like where I live, you know, he knows now, and he was the one I was the most afraid to tell, and he's the most supportive. Like when we conversate about my illness, he don't want it broadcasted, you know, because you know how ignorance is. So, like I told him, y'all came by yesterday, and you know, the more help you can get counseling wise, because I'm getting very depressed. It's depressing. The medication makes you very sick. I'm scared because nobody really tells you the truth, the real truth about the disease. You understand what I'm saying? I mean, not even the doctors really tell you the real truth. Okay? The other side effects, it causes seizures. I have epilepsy, so the epilepsy counteracts this medication. So it causes, you know, I'm on a constant antibiotic to keep my immune system up. They change it frequently. But I know there's only 6 really good medications. I have a really good doctor, Dr. Jume, who's wonderful. And for other HIV patients, I know you guys have a program. It's called Empower You, and they're wonderful. They're Ryan White. They take care of everything.
Well, I just wanted to talk to you, and I'm glad that you took the time to actually be interviewed by Leap of Faith Productions, also known as the Leap of Faith Foundation.
Okay.
And we are going to do a wide range of interviews with people, and you are going to be able to go to the website and look at it at leapoffaithprod.com.
Okay.
And again, your name is?
Josephine Rivera. I'm 42 and I'm Puerto Rican. Like I said, I used to be a prostitute in the street. I'm a recovering prostitute because I still go out there and do what I'm not supposed to. Just, you know, you got to let people know if you have it. Never think it's not you, because I used to think it could never be me. And it's me. And I used to shoot drugs in Overtown, share needles, and having any prostitute that say they never had unprotected sex is a lie. Any drug user that say they never shared needles or stems, and you know, I also have hepatitis C, which is also another complication. So people just need to really be aware, and I'm very outspoken, so